What if I told you that a small electric current could make stubborn wounds heal faster? It sounds like something out of a sci-fi movie, but electrical stimulation is a real, evidence-based treatment for wounds that refuse to heal. For those who don't know me, my name is Dr. Voltaire, a certified wound care physician, and today we're going to break down how electrical therapy works, the science behind why it helps wounds heal faster, and who benefits most from this treatment. Because here's the thing, wound healing isn't just about dressings and antibiotics. Sometimes we have to wake up the body's healing signals, and that's exactly what electrical therapy does. Let's dive in. So think about what happens when you cut yourself. Your body sends out tiny electrical signals that tell your skin, hey, we need to repair this. Your cells respond by moving toward the wound, creating new tissue and closing the gap. But sometimes wounds get stuck. The healing signals weaken, and instead of repairing, the wound just sits there, open to infection. So electrical stimulation restarts that stalled healing process by sending a controlled current into the wound. This jumpstarts the cells and improves blood flow and tells the body, this area needs fixing. So this isn't just a theory. There are studies that prove that electrical stimulation speeds up wound healing. There's one study published in the Journal of Wound Care that found that patients who received high voltage pulse current HVPC therapy had wounds that healed 50% faster than those who only received standard wound care. There's also a 2020 review in the International Journal of Lower Extremity Wounds that found that electrical stimulation not only sped up healing, but also reduced infection risk and improved oxygen delivery to tissues. So this isn't some experimental treatment. This is something that wound care specialists have been using for decades. So what types of wounds benefit from this treatment the most? Not every wound needs electrical therapy, but it's been shown to be most effective for diabetic foot ulcers, especially those that have stalled and aren't closing after weeks of standard treatment. Pressure ulcers also benefit. These often struggle to heal because of poor blood flow and constant pressure. Venous ulcers also benefit. Electrical therapy helps by improving circulation and reducing swelling. You also have surgical wounds that won't close. Some post-surgical wounds fail to heal properly, and electrical therapy can kickstart tissue growth. So there are different types of electrical therapy used in wound healing. Not all electrical stimulation is the same. There are a few different methods, and each are designed for specific types of wounds. So you have high voltage pulse current. This one is one of the most widely used types of electrical stimulation in wound care. It helps reduce inflammation, improve blood flow, and encourage new tissue growth. There was a study in the Journal of Physical Therapy Science that found that HVPC not only sped up healing, but also reduced pain in wound patients. You also have microcurrent therapy, which uses very low electrical currents designed to mimic the body's own natural healing signals. This is particularly helpful for burn wounds and skin grafts. So how does electrical therapy compare to other treatments? Let's be clear, electrical therapy isn't a replacement for standard wound care, but when combined with proper wound debridement, moisture balance, and infection control, it can significantly speed up healing. So compared to antibiotics, electrical stimulation doesn't kill bacteria directly, but it helps improve circulation, which allows the immune system to fight infections better. Compared to hyperbaric oxygen therapy, electrical stimulation can have similar effects by improving oxygen flow to the wound, but it's cheaper and it's easier to access. Compared to negative pressure wound therapy, both NPWT and electrical stimulation help draw new cells to the wound, but electrical therapy may be a better option for deeper wounds. So are there any risks? Electrical therapy is generally safe, but it's not for everyone. So patients with pacemakers or defibrillators should avoid electrical therapy because it can interfere with their device. It's also not recommended for wounds with active bleeding since the current could increase blood flow too much. Also, if a patient has a history of seizures or nerve disorders, electrical therapy should be used with caution. That's why it's always best to consult with a wound care specialist before starting any new therapy. So electrical therapy is constantly evolving. Some exciting new developments include bioelectric dressings. So these are special wound dressings that deliver a continuous low-level electrical charge to keep healing signals active. You'll also have wireless electrical stimulation devices, and these allow patients to receive electrical therapy at home instead of needing in-clinic treatments. There are also personalized electrical settings. Researchers are working on ways to customize the electrical current based on the wound size, depth, and healing stage. So should you consider electrical therapy for your patients? Well, if you or your patients are dealing with a wound that won't heal, Electrical therapy might be the missing piece. It's backed by decades of research, has minimal side effects, and is being used in leading wound care centers around the world. Thanks for watching. If you're curious about what other wound care treatments that actually work, watch my next video where I break it all down. Stay informed and heal well.